Hello guys. Yes, here in this video let's discuss about the GPAT important subjects and topics to study. Okay, GPAT previous I have made one video on basic information on the GPAT. Means what is this GPAT? Okay, the accommodation after clearing of the GPAT. Okay, what opportunities can you get by clearing this GPAT? Actually, how to clear the GPAT also I have made one video. Okay, that video is very important. First to observe that video, you watch that video, and that video will be added in the description. Go to the description, watch that and come to this one. Okay, GPAT here in this video what we will going to discuss means important subjects. See, many subjects are there in pharmacy, but here you have to select some particular subjects. You cannot read the whole syllabus. You cannot read all the subjects simultaneously. So better you select the subjects. Okay, selection of subjects plays a vital role here. Okay, select the subject first. After selecting the subject, you select the topic in that particular subject. You select the subject. Okay, now for an example, you select pharmacognosy. That in that pharmacognosy, what topics you have to cover. Okay, which topic is easy, which topic asked repeatedly in our examination, in the GPAT examination. Now see for an example, alkaloid topic. Okay, on the alkaloid or glycosides, they are asked many times in the examination. Or preparation of the volatile oils, extraction of the volatile oils from the plant, they are asked many times this question. So you give more preference on that questions. Okay, why? Because means many times there is a chance to ask from that topic only rather than other. So better you give a concentrate on the topic also. Clear? Then smart work to clear GPAT means here just we have to work smartly. Hard work is also essential, but the majority is here smart work. To clear the GPAT, smart work is a very important, very necessary. It plays a vital role here. So be in video until last. You don't worry at all, because we will start multiple choice questions from next class. A particular subject. First I will start with the pharmacology. Okay, from 4th semester we will start a particular content we will take. Okay, I will go through the question papers. From that question paper I will select one particular topic. From that particular topic we will solve minimum 100 questions, minimum 50 to 100 questions we will solve, because you have to make your base very fit and fine. Okay, if a base is good means then you can build a huge tower. So here the base is very important. To make our base fit, we have to, what we have to do to make our tower fit means we have to build our base perfectly. So 100, whatever it may be, 100, 50, 70. Okay, minimum we will solve 70, 80, 100 questions from particular topic. So subscribe this channel, very important channel for your GPAT exam. Maybe you can clear your GPAT examinations. Yes, let's start the subject related to the GPAT. Okay, which subject play a vital role and which topic. Yes, first we start with the pharmacology. See, pharmacology, it is one of the major subject in your GPAT exam. Clear? If you thorough with this pharmacology means you will get for 500 marks easily you can score 100 marks only in pharmacology. Okay, 100 marks only in pharmacology. Why? Because direct questions they will ask in the pharmacology. Now in this pharmacology, where you have to give preference means see pharmacology. In that pharmacology you will cover the topic of pathophysiology also. Okay, patho, what you read in your which one, that second semester, no, pathophysiology subject, and that in that you have to cover here pathophysiology. In that pathophysiology you go for the cell, means reversible cell injury, irreversible cell injury. Okay, then the cancer pathophysiology of the cancer, ulcer pathophysiology, then liver cirrhosis. These are the simple topics. And the pathophysiology of the angina pectoris, pathophysiology of the tuberculosis. These are the very important topic. From this you will get minimum 4 to 5 questions in the GPAT examination. From patho you will get 20 marks. So don't leave this patho. Very easy subject. Very there is no complication in that patho. Next you have to go for the some of the cardiovascular system diseases. Okay, the diseases which is caused due to the cardiovascular system, that is CVS. In that you will get some of the medicines to treat the cardiac problems like angina pectoris, or any type of the myocardial infarction, any type of the heart disease. Many drugs are there to treat the cardiovascular diseases. You will learn in third sem, you will learn in that fifth sem also, sixth sem also, you will get the cardiovascular diseases. Clear? After that cardiovascular diseases, you go to the autocoids. Autocoids means in that you will learn some of the histamines drugs, very important topic. Clear? After that you go for the general mechanism of action in the pharmacology. All drug, you take all drug. Okay, in that all drug, which you are capable to practice the mechanism of action, you go through that, but you don't leave the CVS, central nerve, sorry, that cardiovascular system, because cardiovascular system is very important here. Okay, you have to learn all the mechanism of action of or pharmacology of the cardiovascular system drugs. Then some of the drugs, for an example, you take tuberculosis drug, they are also very important. Endocrine glands, means the drugs which will stimulate the endocrines like thyroid, anti-thyroid drugs, that is also play a vital role in the pharmacology. You just listen this video, because just basic information I am giving which subject plays a vital role. Okay, after discussing the particular topic, you will get it. Then in pharmacology, we can read some of the diuretics. Antidiuretics also play a vital role here. Okay, then treatment for Alzheimer disease, some of the levodopa, alpha dopa, what we are giving, no, yes, that also play a vital role. Then we can go some of the NSAID, non-steroidal anti-inflammatory drugs, morphine drugs. Okay, that is a steroids, what we morphine drugs, or next is a steroid drugs, very important one, steroids drug, that is deflazacort, hydrocortisone, prednisolone. These all are the hydrocortisoids drugs, or glucocorticoid drugs, mineralocorticoid drugs. Okay, yes, next subject of our is here, that is very important. Asked many questions from this subject, that is MC 1, 2, 3. From MC1, MC2 and MC3. From MC1 they will ask just basic one. Okay, just basic information on the medicinal chemistry, just basic questions. They will select one topic from that and they will ask in the form of the MCQ. Then they will ask on the basis of the some of the NSAIDs. Okay, and the structural activity relationship, they will draw one structure, and on which position, if there is a change, means what the property of that drug, this type they will ask. And they will ask some of the uses here in medicinal chemistry, MC1. Okay, and in medicinal chemistry they will ask some of the additional questions, like what you are read in pharmaceutical organic chemistry, no, that also comes in the medicinal chemistry. And in MC1 medicinal chemistry you will get some of the analysis questions also, pharmaceutical analysis questions also you will get. And in MC1 you will get some of the pharmaceutical chemistry questions, means inorganic chemistry, what you read in first semester, no, that also here they will ask. You will ask some of the impurities there. Then limit test you will ask here. Okay, limit test, why we, for an example, see why we use nitric acid, or why we use the citric acid in the limit test of the lead, why we use. Then why we use the not in lead, sorry, in iron, citric acid. Then why we use the thioglycolate. Okay, that is thioglycolic acid in the limit test of the where we use that one, thioglycolic acid, it is used in the limit test of the iron. Then why we get the purple color in thioglycolic acid. Okay, these are the simple questions you will get. Go through these questions in pharmaceutical inorganic chemistry. Then our next subject is a very important subject that also, that is pharmacognosy. Basically this pharmacognosy is there, no, it is a basic subject, means only two sessions we have to discuss here, pharmacognosy 1 and pharmacognosy 2. In that pharmacognosy 1, some of the different types of the drugs are there, like crude drugs are there, classifications of the crude drugs, evaluation of the crude drugs, adulteration is there, then volatile oil preparation. Then if you go for the 5th semester, there you will learn some of the resins. Okay, and there you will go some of the preparation of the volatile oils, and some of the cycles are there. Okay, malonate pathway is there. Then some of the pathways are there, that is also play a vital role here in pharmacognosy. Are you getting what I am telling? So pharmacognosy, it is a direct subject. Direct subject means the questions will be asked directly from this. Okay, there is no chance of asking indirect questions in pharmacognosy. Direct questions they will ask in pharmacognosy. Clear? After pharmacognosy, then biochemistry. In this biochemistry also very important and interesting subject in the GPAT examination. In that biochemistry, you have to learn the cycles. Cycles means just you glance that cycles, no need to practice that cycle, just you glance. They will ask in that only. And how much ATP is consumed in the citric acid cycle. This type simple questions they will ask. How much ATP is required, okay, in the pathway of which one that glycolysis or gluconeogenesis. This simple questions you have to remember. Then in biochemistry you have to know the cofactors, coenzymes. What is the enzymes? Inhibition factors of the enzymes. Then insulin. What is this insulin? What is the glucagon? What is the role of that insulin? What the role of the glucagon? These all simple basic questions you have to remember. Clear? And carbohydrates, lipids, disorders of the lipid metabolism, disorders of the carbohydrate metabolism. Then after biochemistry, there is one more very important subject that is the pharmaceutical analysis. In that pharmaceutical analysis, maybe sometime what they will do, they will ask this analysis in the chemistry, means medicinal chemistry. Like they will ask some of the complexometric titration, okay, analysis, complexometric titration, or they will ask precipitation, gravimetry, okay, or sometimes they will ask applications of the pharmaceutical analysis. These basic questions they will ask from the pharmaceutical analysis. One is complexometric titration is very important. Complexometric titration is very important. Okay. Then gravimetry also very important. Precipitation also very important. In that you go for the Fajan's method, Moore's method. These methods are very important. Vollard's method, modified Vollard's method. They ask many times in the examination. Clear? These are the very important subject. Next, biopharmaceutics is there. In that biopharmaceutics also they will ask, and also in pharmaceutics it is also a very important subject. Before only I have to discuss this pharmaceutics, but I forgotten. Pharmaceutics. See, one of the major subject in GPAT exam. If you practice only pharmaceutics and pharmacognosy, pharmacology, these three subject means you will clear your GPAT. Yes, but you have to give more preference on these three subject. Why? Means they are asking direct questions from these. Pharmaceutics, direct questions. Cognosy also direct. Ecology also direct. There is no diagrams or no events of which one, that is structures. Direct questions they will ask. Just you have to apply your mind and answer it. In pharmaceutics they will ask some of the questions from the first semester you read the pharmaceutics basic one. They will ask from that, and they will ask from the your physical pharmaceutics 1 what you read in the third semester, and in fourth semester physical pharmaceutics 2 that they will ask rheology, micromeritics, then surface tension, surface area. Yes, these are the simple basic questions they will ask. Distribution law, Nernst equation, Nernst law. Okay, what is the equilibrium equation? That topic I am telling. From that topic they will select a particular question and add in your GPAT exam. This, and in you go for the fifth semester, there in the form of the pharmaceutics you will get industrial pharmacy. Very very important, industrial pharmacy. Minimum you will get 10 to 12 questions from industrial pharmacy only. Sometimes they will give 20 questions from the industrial pharmacy. See, what is the weightage of this industrial pharmacy? There you will get compression method, means preparation of the tablet by compression method. Preparation by paracetamol, by which method? By compression method. These the basic questions they will ask in pharmaceutics. And they will ask some of the pre-formulations. Okay, right? Or means pre-formulation studies. Then they will ask on the basis of the elixirs, how to prepare these elixirs. Then preparation of ointments, preparation of some of the creams like vanishing cream, cold cream, preparation of the some of the lotions they will ask. Then ingredients we use in our pharmaceuticals and biopharmaceuticals. These basic simple industry important questions, knowledge based questions they will ask in the GPAT. So better what you do means you go once through the question paper. You take one previous year question paper, or you collect 10 to 15 question paper. You go through that topic. Which topic is repeatedly asked in your GPAT exam? Definitely they will select that topic only. They will not break that topic. Okay, they will definitely choose that topic only for your exam, but just they will tilt the question because that is a national level exam which was conducted by the which is conducting by the NTA, National Testing Agency. So better you have to be tricky one, because the questions are some most tricky, not all, but some questions are tricky. In 100% you will get 30% questions tricky, 70% direct questions. Yes, this is the basic information of your GPAT exam subject and the topic. One is very important, pharmacology, then for medicinal chemistry, then pharmaceutics, pharmacognosy. Okay, after that minor subjects like biochemistry or your microbiology and your pharmaceutical engineering, then analysis, pharmaceutical analysis, these are the minor subject. Pathophysiology, it comes under the pharmacology. Yeah, yes, these are the very important topics, subjects of your GPAT exam. So better you go through this video and hear this video until last. Some important points I have covered here in this video. Clear? So you share this video, because sharing the video helps your friends to get the basic knowledge of the GPAT. Many students, they don't know what is the GPAT. Okay, what criteria is framed in the syllabus of the GPAT. That is very important. Before doing anything, you have to study basic pattern of that. If you don't know anything about the exam means, then what you will study? First you make a plan what to study. That is very important. Making a plan is play a vital role in the GPAT examination. Without plan, if you go on studying whatever you want means, no, it's very difficult to clear your GPAT exam. So uh, if you like this video, so please share with your friends, and subscribe the channel Let's Join Pharmacy, which is updating for you on the GPAT exam. Thank you.